30 years ago, anybody who walked into this clinic, we knew was going to die. We expected them to die. And by 1996, just before the good drugs came out that saved a lot of people, half of our clients that year died. Now, if you walk into the HIV clinic with a newly diagnosed infection and get started on our medications, you will live a long and normal lifespan with very good health. So treatment these days means that you can't harm anybody else and that you'll live a long and healthy life. So these are two huge changes that have happened over the last 30 years. In 1991, when we first opened, the only drug available was AZT. It was toxic, it was very hard to take, and it didn't work. Now we have the possibility of giving you one pill once a day with 3 drugs that take care of the virus in various combinations. And these pills, one pill once a day, works well, saves your life, causes very few side effects. And for most patients, this is just another mild routine. They go back to their lives, and HIV becomes, in many ways, something in the background of their life, not in the front of their life like it was 30 years ago. So 30 years ago, if a woman was pregnant and was HIV positive, there was at least a 25% chance that the baby would be born positive, which was difficult. But now with modern treatment, there are almost no positive babies born in Canada. 30 years ago, this disease was associated with a huge amount of stigma and shame and ostracism and judgment. There was just the diagnosis of HIV alone, people would be afraid to touch you, family members would not want you touching their children, many things that were not scientific, but were still this hysterical reaction to the virus. Just the fact that most of the people in Canada who were HIV positive 30 years ago were gay men, at that time being gay was not acceptable. Families were ashamed of it. Many people were still in the closet with their sexual orientation. So it was a time of darkness and fear and shame. That has changed a lot. That's not to say we don't still have discrimination and issues to deal with. But just think, we legalized gay marriage, we've legalized marijuana, drug addicts are no longer lurking in the corners. They can come in for treatment, they can get methadone, there are needle exchange programs. So we've gradually learned not to judge people and treat them in a discriminatory manner. So that's a huge change, and that's because of HIV. The scientific community has done an amazing job of deciphering viruses, developing technology to make that easier and easier and easier. So, for example, everything that went into understanding HIV, the virus itself, all that technology has become so advanced that when coronavirus came around, it was really within days and weeks that they were able to decipher the genetics of the virus, and actually within months come up with vaccines, which 30 years ago not only would have taken forever, would just not have been possible. But more than that, it's also HIV mobilized communities. The amount of political activism for gay rights, for access to medication in the third world, the developing countries, where the drugs were just not available because the cost was prohibitive. All of these forms of activism from the grassroots, from the people who are actually affected by this problem, pushed governments, pushed society, pushed the media, pushed entertainment, so that the social discourse became much more favorable and much more tolerant.